Hey everyone, Steve from Rupture Physical Therapy here. My video is going to show the proper way to perform a kneeling hip flexor stretch. So this is a stretch we use a lot in the office to combat hip problems. Various hip pain conditions can be correlated with tight hip flexors. It also can be correlated with low back pain as well. So this is a good stretch to do. Sometimes technique can get a little funny, so I'm going to show you a couple tips to make sure you're doing it properly and getting the most out of the stretch. So first thing you want to do is you want to kneel on the affected side. So I'm going to show you in this demonstration how to stretch the left hip flexor here. I'm going to go into a side view. So I'm on the left side here. You may want a pad or a pillow underneath your knee if the knee's uncomfortable on a hard surface. So you're kneeling to begin with. We want to get the trunk up tall. You don't want to be leaning. We also shouldn't be excessively rotating. Sometimes you'll see people in a hip flexor stretch and they're way forward and they're arching the low back. It's poor technique. It's going to hurt your back and cause more trouble. You're not really going to get an effective stretch on the hip flexor. So you're up tall at the trunk. Then we want to perform what we call a posterior pelvic tilt. So we kind of want to rotate backward, tuck the bottom in, and then you're going to feel the hip flexor engage right away. Remember, hip flexors are in the upper part of the thigh here, run into the trunk as well. So you should feel that. If you're performing that pelvic tilt, we should get some tightness right away on the front of the hip flexor if the trunk's up tall and we've locked in that tilt. From there, it helps to add in a little extension with the arm straight up overhead. Now we're really opening up the entire anterior component. You can also, which I'll show from the front view, once you're in that position, add in a little bit of a lateral lean as well, which will tension that even more. Remember, you shouldn't need to be way out here. If you're getting way out here, you've lost technique along the way. Tall trunk position, keep locked in, arm extended overhead. If you're losing your balance, put a chair or something next to you to help stabilize. Good 15-20 second hold on the stretch, 5-6 of those, and you can do those once or twice a day. Help combat all the sitting and general lack of mobility that many of us are getting these days. All right, hope that helped, and we look forward to seeing you back in the office in June. Take care.